Today we're talking fertility in one of the Bay Area's leading fertility specialist office. Dr. Aimee, thank you for having us
Hi, Heather.
today. You have a special person with you here.
I do. This is Kermie, and she's a mom to IVF twins just born 3 weeks ago.
Yeah, that's not fair, Kermie. You look way too good for just having 2 babies.
Heather, you should have seen her through her pregnancy.
Oh.
I mean, she looked amazing, bikini and all, even up until the very, very end.
All of this is amazing considering the road you had to deal with. This all started, you had a baby naturally, everything was fine, and then what?
Well, after 6 months of trying, I ended up going back to my OB's office, and she put me on a medication called Clomid. Wasn't very good to my body, and chatting with a friend, he suggested that I go ahead and find out what's going on. Through genetic testing, we found out that my husband and I are both predispositioned for cystic fibrosis. And in that, we were looking for a fertility doctor, and we ended up with finding Dr. Aimee.
And you guys sort of hit it off from the beginning, is that safe to say?
Absolutely. She is my magical doctor.
I mean, what kind of magic did you pull off here? Because they did have a lot to deal with.
Right. So when you have a husband and wife that are both carriers for a disease like cystic fibrosis, you know that the child has a 25% chance of being affected with that disease. So through high-tech treatment called IVF with PGD, so that's where you can actually take a biopsy of an embryo, run the biopsy for a DNA test to see if the embryo actually is a carrier for cystic fibrosis or not. Then if you find out beforehand, you can prevent passing on that serious disease.
And then voila, you end up with these gorgeous twins. How are they doing?
They're amazing. They are unicorn babies.
Congratulations. If you'd like more information about Dr. Aimee's practice, you can go to her website, draimee.org.
This segment is sponsored by Dr. Aimee.